The top US infectious diseases expert in the US, Dr. Anthony Fauci, has warned that the country is heading in the wrong direction as cases fueled by the Delta variant surge amongst the unvaccinated. He's particularly concerned that cases are spiking in areas where vaccination rates are low, and he believes that COVID-19 is now an outbreak amongst the unvaccinated. A recent sobering statistic from the CDC says that 99% of recent COVID deaths in America are among those who had not had a jab. Official data shows that more than 162 million people, or 49% of the population, have now been fully vaccinated in the US. Well, Dr. Marcus Plesch is a Chief Medical Officer at the Association of State and Territorial Health Officials. He joins me from Charlotte in North Carolina. Thanks very much for joining us. Is the spread of the Delta variant encouraging people to get vaccinated, in your view?
I think it has recently. Over the last week or so, we've started to see some slight increases in vaccination participation. We'd like to see much more, but we are seeing it start to trend up a little bit. And we're hearing from people that this has gotten their attention. And I don't think it's the hard and fast people who are determined to not get vaccinated. This is more the people who are kind of in the balance, and this has kind of pushed them to go ahead and take action.
How serious is the increase in cases across the US at the moment?
Well, it's particularly serious in probably 6 or 7 states, the states in the southeastern part of the United States and a few states in the Midwest. That's where we're really seeing these significant increases. Other parts of the country where vaccination rates are higher, we're not seeing as much of a problem, although even in those states, we're starting to see things creep up.
What about people's behaviour and wearing masks? Does policy on that need to change?
Well, right now the policy is that if you've been vaccinated, you don't need to wear a mask. And so far as we understand from the science, that's a solid policy. I mean, people who are fully vaccinated, we have very good vaccines. They're very, very effective. We're lucky. And so the protection is very good. And even people who do have breakthrough, we've been seeing some breakthrough cases. Even in those cases, those people are unlikely to get acutely ill or end up in the hospital or end up dying. So right now, that's the overall guidance from the Centers for Disease Control. And most places are still following that guidance.
And yet, you know, we have seen here in the UK with the spread of Delta and, you know, in other parts of the world, of course, that even those who are double jabbed can end up in trouble.
Yeah, we have seen some of that. We've seen some places where the protection from the vaccine breaks through. We're seeing that more and more in the news. Partly that's because we're vaccinating so many people. Even a small percent is going to turn up as a significant number. The important thing for us right now is that we're not seeing those people get acutely ill. So they may develop symptoms, have the virus, but they're not ending up ill enough that they have to go to the hospital or that they really get into major trouble. And so that again shows that the vaccine really does confer this significant level of protection.
What about the problem of the stockpiles of vaccines that the US has got, and whether if they're not going to be used up because of vaccine hesitancy, should be distributed to those many countries that need supplies?
Yeah, right now we probably have about 50 million doses of vaccine that have been put out to the state programs. So they're out in the field and the states are working on distributing those vaccines. And those are the ones that we're the most concerned about because we've been told at least that the logistics and the challenges of taking those vaccines back and redistributing them are really too much to be able to do it. Now, the federal government has a surplus and a reserve as well, and I'm not sure how many vaccines are there. I think that redistributing the vaccine and sending it abroad would probably be done with the federal stockpile. 50 million doses in states. I mean, I think we have some optimism that by the fall, which is when we might begin to see significant amounts of expiration, I think we really will have pulled that number down a lot by then. But that's a concern for everybody because it's a very valuable resource for everyone, and we don't want it to go to waste.
What are the dangers of giving people doses that are at their expiry date or might have just gone beyond it? I mean, and is it a hard and fast date?
It's, I think because it's a new vaccine, we're learning how long the vaccine works. We've already had a situation with the Johnson & Johnson vaccine where the FDA, the Food and Drug Administration, did extend that expiration date. We might see that with some of the other vaccines. The big concern is that after a period of time, it might just not be quite as effective. And we don't want to give somebody a vaccine that's not as effective. We want to make sure we give them whatever will confirm the most immunity.
In terms of trying to persuade those who are really opposed to vaccination, and obviously, people have legitimate concerns about, the longer term effects, but ultimately it's a balance of risks, and governments everywhere are recommending vaccination. If there is a spread of Delta that grows, do you think that ultimately might do the trick for some?
Yes, I think we're starting to see some just the fear of what's going on motivating some people to get vaccinated. We're also now really trying to provide more and more of these vaccines through doctors' offices, through primary care practice or GP offices, as you would call them. And we find that's a very effective way to counter vaccine hesitancy or help with vaccine hesitancy. So there's been some challenges because the way the vaccine is packaged, it's hard to get them out into these smaller settings. But as we do that, we're very confident that may help increase the rates of participation as well.
And they have to be used up more quickly, don't they? Because they can't necessarily be stored at the right temperatures in a GP surgery, and therefore there are separate issues around that. What about the question of vaccination passports, COVID passports, that is being looked at, for example, in the UK?
Well, that's still a bit up in the air here. Pretty consistently, President Biden's administration has said they're not going to do that at a national basis, and several states have actually ruled against any kind of vaccine passport. So we'll have to see what happens. Part of the vaccine passport concept really has to do with requiring vaccination, and we are starting to see vaccination being required. In many of the U.S. colleges and universities, you won't be able to go to college or university in the fall if you can't show proof of vaccination.
Very interesting. Dr. Marcus Plesher, very good to speak to you. Thank you so much for your thoughts.